Yes, so Dr. Reginald, the floor is all yours.
Yeah, all welcome. Greeting from Professor Francesca and Professor Miriam and our VC from Amsterdam and the engagement that involved in. I've just received a message from Professor Francesca wishing everybody well. So we thought that having had such a big symposium yesterday, that will be the first point on our agenda, just to review a bit, discuss a bit, our experiences. Then Mariam, we can lead us through just a quick round across the countries about the deployment. And then of course, Dr. Raya always has something about the theory of change. I think those are the three main areas, Mariam, is that so?
Yes, that's right, Dr. Reginald.
Okay, so yesterday we attended a very important symposium. My impression was that VODAN Africa is growing and that it's receiving international recognition. It just shows how everybody has worked very hard to reach where we are, because it's everybody's efforts that was being recognized yesterday at that symposium at the University of Leiden. And when Professor Francesca was speaking and Professor Miriam was there, you could tell that the mood changed among the audience, that Kampala International University, together with the partners, they're leading a very creative and innovative concept, which has never been experienced before. And with the time, it's going to help build good health infrastructures in our countries beyond what anybody imagined. So that was my impression. So we just thought that to be fair for each person to give their impressions before we go to the main agenda. So please, you're welcome. About 5 minutes just to deliberate on this, how you thought, how you felt, and then we shall also convey the same to Professor Francesca, Professor Miriam, and also our VC. So you're welcome.
Maybe Ibrahim has something to say, or anyone on the call about the conference yesterday.
Mekele team, Mekele team.
Yeah. Hello, Dr. Reginald, Mariam, and colleagues. Good afternoon.
Good afternoon.
Yeah. Yes, and yes, yesterday's conference and the success of VODAN Africa was an exciting moment. As Magala team, we were attending as a group, and we were very excited. We had a communication problem. Our connectivity was very low, but fortunately, the connection was good when the presentation of VODAN Africa was made, and we saw the competition and the award. So all of us here were excited, and it's really inspiring. And we felt that the conference organized by Leiden was a high-level conference, and this gives a global visibility to VODAN Africa initiative. And we felt that in the conference, in the symposium, there were many initiatives, but unique of VODAN Africa is the number of African countries involved in the initiative is high compared to other initiatives. I didn't see any initiative like VODAN Africa which involves many countries from different parts of Africa. That was different, and Professor Francesca, Professor Miriam, they did a very nice presentation, and the fact that both presenters were women, I think it gave a different spice to the symposium, I would say, and they were really excellent in their presentation. I believe that they represented us very well. We felt like we all of us were represented in the symposium. Thank you so much.
Thank you, Dr. Raya and the Mekele team. Anybody else? Dr. Ibrahim says he cannot unmute, so it's okay. Anybody else would like to give their views from yesterday's symposium? Dr. Ibrahim says it was a great representation and we are very proud of the team. Thank you, Dr. Ibrahim. Yeah, Ubuntu. Thank you. Oh, yeah. Susan, lawyer, please go ahead. Susan, go ahead. Susan, we still can't hear you. Meanwhile, we have our communications man, Obina. Obina, what was your impression for you? I know you are the technical person, but what did you say about the symposium yesterday?
Hello, Dr. Reginald.
Hello, Obina.
Can you hear me?
Very well, very well.
Okay, the event yesterday was very awesome from the presentation of the guy from government of Rwanda. You know, many discussions and the presentation of Professor Francisca and Professor Miriam. You know, and the panel discussions that follow it. Many issues were discussed, and it was a very eye-opening event. So it was awesome.
Thank you, Obina. Thank you very much. So one more person maybe, and then the other agenda. Susan, we can't hear you, but you can also type in the chats. Gusite, go ahead, please. You wanted to say something. Yeah, Susan said she was very proud of the team. Thank you, Susan. Okay, well, we can still have a moment to share for some, I'm sure, on Friday, again in the GAIC meeting, there'll be this discussion, but thank you very much. So it was a global impact on health in health symposium. That was the conference, and we took the first prize. That's why we're sharing now. So thank you very much. Back to you, Mariam. We can go on with the other agenda. Thank you.
Well, so next on the agenda, we'll have the deployment updates from the different health facilities. And maybe we can start with the Mekele team.
Hi, Mariam. Hi, everyone. This is Gaitu. So there is no much updates. However, we managed to install Ubuntu operating system in the server space that was provided by the Hyder referral hospital. So now we are in the preparation to deploy the VODAN MVP, which is a CEDAR Cedar application in our laptop, and we cloned it, and we will deploy it into the server. We tried it with a simple laptop, and it works well. So I hope in the next few days, we will able to deploy the MVP, and we will begin the testing phase. I mean, we will try to encode real data and see how the application works. Thank you very much.
Okay, thank you, Getu, for the update. Maybe we can now also get an update from Ibrahim, Nigeria team. Oh, so Ibrahim had an issue with unmuting the mic. On the call, we have maybe, so an update from Uganda. The deployment is already done within 2 health facilities. The personnel is now testing the system and basically are learning how to do data population and the basics on how to use the system in general. And the third facility, which is Lira, just received the computer, and they'll also be doing their testing this week. Then the rest of the health facilities, the 2, the computers are currently in transit to the locations. And yeah, so far that's the current updates from Uganda. I see Abdullah, he joined the call. Maybe he could speak on behalf of Nigeria since Abdullah had an meeting.
Yeah, sorry for joining this time. So in Nigeria, as we have shared in the group, all the computers receive what I think 4, so probably around 17 of them have been received by the facilities and have even been, some of them have started to use them already and have sent in videos. And we have actually created, I think, a WhatsApp group that enables us to also follow up on their progress and resolve any technical challenges, which have been interesting and exciting at the same time. So in Nigeria, largely, we have deployed, and it has been successful. I think from our evaluation, yes. Thank you.
Oh, thank you, Abdullahi, for the updates. So maybe we'll then move to the next part of the agenda. I don't know if Dr. Reginald is still on the call, but okay. So basically, the next bit of the agenda is the discussion by, is it Dr. Araya? Do I have that right, Dr. Reginald?
Yes, the theory of change. Yeah. All right.
Hello, Mariam. Hello.
Hello, Dr. Raya. Go ahead,
Yeah.
please.
Yeah, I think I see Tegust in the call. So if she can speak any update or progress from Ethiopia, that would be good. Mariam, maybe. Tegust and Ephraim, I think. Tegust and Ephraim, if may you please give us an update on the progress of deployment in Addis.
Thank you, Dr. Araya. Can you hear me?
Yes, you're clear, very clear.
Okay. There is no such a new update, but the money transfer has been conducted today, and we received a confirmation slip and email from Christina, and we wrote a letter for main campus for the transfer of money to be confirmed and transferred to the School of Public Health. And the other thing, we communicated with the Kurambasa Specialized Hospital for the deployment and to test our implementation, and they are ready. And if the guest has something, she can add. Thank you.
Yeah, thank you, Ephraim. If there is any additional idea or anything you would like to say, Tegust, you are welcome.
Okay, thank you, Dr. Araya. There is no additional thing to add, but as soon as we get the computers, we can start the deployment at a selected facility. And we already select the data stewards and the technical team, and we are ready to deploy. Thank you.
Thank you, Tegust.
The McKinley team, are you still there, Dr. Raya? Anything from your side about the theory of change? I think they're coming back. They had dropped out. Dr. Raya?
Yes, sorry, I was disconnected for a moment. Yeah, thank you, Tegust. And may I continue with the issue of theory of change, Dr. Reginald? Or?
Please, yeah, go ahead. Yeah, because that's the last item on our agenda. Yeah.
Yeah, I think if there are any thoughts regarding with the exercise of writing our theory of change. When we say our theory of change, it's all about what are the activities we need to make, what are the outcomes we want to achieve, and the impact we want to make. So as a whole, as a VODAN Africa initiatives, we have the general objectives or the general aspirations, but this has to be contextualized in each country, and we have to internalize every one of us depending on our context. So if there are any updates or any questions from each country, we can it would be good to hear, but I want also to relate it with Nigerian experience. In the WhatsApp group, the Nigerian team has shared as a good launching event of the VODAN Africa initiative. I believe in this launching or starting of the VODAN Africa initiative, there were stakeholders, at least the health facilities, either the managers or the head of the health facilities were there, because we saw there were a kind of transfer handovering of the VODAN MVP, the computers. So how was the exercise? How did you introduce VODAN Africa initiative? What are the aspirations, the objectives that you shared with the stakeholders? So the Nigerian experience could be a good stimulation to other sites as well. So one, if we have Ibrahim or other members of the Nigerian team, they can share us their experience, how they engage, how they describe, how they try or explain the bigger picture or the outcomes or the outcomes of the VODAN Africa initiatives. That is one. Second, probably in the yesterday symposium, there were other initiatives who were recommending for digitalization or for having a real-time data collection. Dr. Reginald, Mariam, if you noticed the initiative or the presentation of maternal and child health surveillance, it was a team of Dutch scientists, UK Yeah, I'm back. Can you hear me?
Yes, you disappeared
Hello?
for some seconds. You're back now.
Yeah,
You can hear you.
yeah. So yes, so yesterday in the symposium, there was an initiative, a presentation of this surveillance of maternal deaths, maternal mortality. It was a team of scientists from UK, Leiden, and Ethiopia, Haromaya University. At the end of their presentation, they were recommending for a digitalized way of data collection, real-time data collection and visualize. So I felt like the VODAN Africa initiative or this digital data and having the data without from remote querying or without leaving the residence is like a global need, I would say. Many initiatives are looking for solutions like the VODAN Africa initiative. So that was a good insight or a good inspiration that I noticed from yesterday's symposium. Although this is like the bigger initiative inspiration, but do all of us see the bigger picture, the greater picture, and do all of us internalize why we are spending our time, our energy, our resources into this whole VODAN initiative. That is what we are trying to exercise through the theory of change. I believe this is a question of all of us, and definitely, as Dr. Reginald repeatedly mentioning in our previous meetings, yeah, I'm back. So as Dr. Reginald has been mentioning repeatedly, when we engage the stakeholders, the leaders of the Ministry of Health, the facilities, and the regional health bureau leaders or district health officer leaders, they will ask, what do we want to achieve by deploying these MVPs or computers? So we have to have a well thought response and description. That's the whole essence. So can we hear something from the Nigerian experience, and we will move to other countries, to Kenya, Uganda, and other countries. Thank you.
Okay, I was thinking Dr. Ibrahim is here. From the Nigerian experience, I would say, first, I think like you did mention, so the VODAN initiative is trying to change the face of healthcare in terms of improving how data is demanded and used. That's how I summarize it, I remember, on my slide. So, which is a major issue, especially in facilities. So when you think about it, data has always and will always be generated, whether there is technology or there is not. But the question is not data. The question is the use and the demand for it. And demand, of course, use is because demand happens.
Abdullahi, hello. Yeah,
yes.
if you have slides, it would be great if you share your slides and present, if it is convenient for you.
So I was not prepared for that. I'm using my mobile phone, but I will share maybe later. Yeah.
Okay. Okay.
Yeah. So I did make a presentation to the representative of the Ministry of Bureau who were present. Also we had the head of the HIV agency, and I was careful in passing the information to them that until they ask that this data be used within the facility, will not have value for the technology. So even if people put data into CIDA and all, if the director in the facility does not check maybe weekly or monthly how that data is evolving and what is telling them, then for me, it's not a great use of the technology. Similarly, for the ministry, of course, they could look at the global dashboard to learn from others and see how they are performing, in addition to also supervising the facilities to see how they are now using that data. Because the data use can come in many forms and shape. It could be for internal use, say the medical directors now notice there's a spike in, for instance, like monkeypox that we're talking, or there's a spike in one disease or the other. They're able to immediately have an internal meeting and discuss next steps. For external use, it could be to also share with external stakeholders. Just taking the screenshot of the dashboard can be used in many presentations by the facility themselves and the ministry, and for whatever use. So that demand must exist and the use must. So demand follows use, if you look at that. But before even mentioning that, just to share our experience in the orientation, we did give the motivation for the whole study. And really, I remember sharing what the key research question was. And I will share the slide after the meeting to say, why did we have to do this and what do we aim to achieve? Of course, if we all remember, it started with COVID, but more than that, there was a lesson from the Ebola crisis, where data is not in residence. And data is also not made meaningful use of. And up till this day, data as it is now in the current situation is just generated from the facility, but the facility does not directly use it. Only maybe the ministry use it through the DHIS by providing that surveillance. So this is trying to change that it's appropriate that if you are a farmer and you farm in your own land, at least even where you are sharing the crop, you should know what you have made. So I'm just metaphorically saying that as facilities, they also need to internally make use of their data in addition to the use through the DHIS by the ministry or bureau. And that's a great addition. So for me, that is how we thought of it. So we did give problem statement. We did give the bigger research question. We did also share clearly what is the role of each stakeholder in effecting this change. So we want to see a situation where facilities use this technology and this the director, the ministry, everyone also key in. So how it's also shared at that meeting. And we plan to go forward by having routine meetings, whether virtually or physically, with the ministry and maybe the directors to clearly ask questions around how data is demanded and how it is used. And this could also even be a research question. There could be really interesting findings from that. But we wanted to see that either as part of their routine meetings with the directors, that question is raised, how is this done? Because eventually we should aim to have a system that may not be hybrid. And there's one aspect of the system that we are still left, or we are still thinking of advancing, which is automatic integration with the DHIS. We know that is still pending. So only the success of the current deployment and use, and I emphasize use, will easily determine that next step of integration with the DHIS. So for us, we have made that also clear, but we are also strategizing by saying in their usual monthly data meeting, can we join them and can we ask this question? Can we get more information? Or do we need to set up a meeting once in a while to find out about this and learn from it and strategize for? Sorry for taking a lot of the time. I think that's just from our experience.
Yeah, thank you so much, Abdullah. It's very helpful for all of us, and your description is really excellent and very clear, very helpful. I wonder, was there any questions, concerns raised by health facilities or by the stakeholders? As you remember, in the contract agreement or in the implementation protocol, there are identified roles, for instance, like privacy, security, access, and control. So were there about capacity development? Were there any concerns raised in your orientation discussion so that we can get prepared? I have an idea to forward to Dr. Reginald and to all of us. Maybe starting next week, we may also need to get updates about any privacy issues being raised while we move on the deployment from facility to facility. What are the major concerns being popped up or raised from the actual implementation, from our own learning, as well as from the perspective or the concern of the health facilities? And we have assigned people to handle the privacy issues. For instance, Putu is working on that. Regarding security, Dr. Ibrahim. Regarding capacity development, Dr. Sakinat, and like on access permission, Dr. Jamal. So I'm thinking that because these roles are also relevant and related with the deployment. So we may, as of starting next week, we may also include these issues in our weekly update and weekly learning. But for now, Abdullah, because your team is like the leader in this deployment process, was there any outstanding issues, concerns raised from the stakeholders so far? Thank you.
So so far, in terms of the responsibility and contract agreement, and this speaks to also privacy. I think in our case, we had given the ministry the document to review, because they have requested that any communication with the facility, they have to be like the first line of communication first. And so they were still telling us they're looking at it. However, we still met the directors. I think we were having to share the agreement with them to have a look and all of that. So that is still in progress. I wish Dr. Ibrahim is here. He is leading that aspect. But I know of one particular, and I did drop that in the chat, or two issues that have come out quite topically. First is the issue of power source to really power these computers. So except in big hospitals, and even for them, sometimes they report that the electricity kinds of trip off. So there could be a sudden, surge of power. So because the computers were just procured, the system unit, the keyboard, and all of that, I think there's need for a kind of surge protector UPS system like that will prevent that, because I could imagine if that continues, that could lead to even the OS damaged, data destroyed, and so many things could happen. So at least something that will handle that sudden surges. The second issue was the internet, as we have seen. Although this has been discussed, I think, with Oluwale and team, and I think I've raised that earlier. Now, yes, with internet, you need internet to enter every record. Now, in the circumstance of, our localities, sometimes even the internet could be either, bad, or you need to also even, it's sometimes at a cost to the data clerk. So we're thinking if that support can be, if there are consideration, that support could be provided for either internet subscription or so, that will help. But at this time, the data clerks are using their phones, connecting, using USB tethering, and this is helpful for the others that are yet to deploy. Some of them, most facilities may not even have Wi-Fi and some of those internet facilities. So what we had used was a USB connected to their mobile phone, especially smartphone. So again, if data clerk does not have a smartphone, that creates a challenge. But for most of them, they do. So we're able to connect the smartphone to the computer system, which was now used for for trying to deploy and data entry. But when you look at it at a longer run, with the challenges of internet, with the challenges, maybe will require some update that should make data entry to not require internet, because you can assume in entering. So a facility reported that sometimes they get over 200 records patient to see, and then you are frustrated that you can't even enter one record because the internet is bad or something. So I think that's the challenge I would say. I know more may come when each of the directors have studied the document of the
Thank you, Abdullah. Very useful and interesting lessons, especially these outstanding issues like the electricity issue, power, and the internet connectivity. And given the time left for our meeting, Dr. Reginald and Mariam, if these issues are observed in your country, respective country, you can share your lessons, but as a quick reflection, I want also to forward to the technical team, would there be any offline solutions? I mean, if data entry is, if internet connectivity is required for every data entry, would there be any solution for offline data entry or a kind of backup plan, as Abdullah said, because of electricity or because of internet connectivity, data could be lost. I mean, after yeah, so I'm back. Maybe Dr. Reginald, Mariam, and colleagues can. Yes.
So, Dr. I think what Nigeria shared is very, very important for all of us. And we can do that, each country, just to mention some of the teething problems they're facing. Because as you move away from the capital, life becomes very difficult. And so this theory of change exercise is very, very important. And then also analyzing how the hospitals themselves are looking at this exercise. So there are a lot of lessons we can learn from Nigeria, and we should continue this exercise until we are sure that we are happy with the MVP, the minimum viable product we're talking about, and that as we move forward in the second phase, these are the questions that are going to generate new areas of focus. So imagine you're working in a very rural area and there's no electricity. How about solar? And who would give us solar? Are there companies out there that can give us solar power? Perhaps General Electric would come in, perhaps a group in California will come in. So this is the direction we're headed. So we should not be afraid to answer these questions and write down any kind of challenge we're experiencing. So I'd say, Dr. Rai, I think we can put a stop to that, but then the exercise to us that each country just mention things as they come out. For example, in the case of Kenya, one of the hospitals, they were not worried about all the other details. I'm signing, they're willing to sign. But then the question that came out was that within the fraternity of VODAN, can we exchange technical teams, medical students, persons that are involved, can we exchange? that from Mekele, you can send students to Gulu or Lira. From Kampala International University can go to Tanzania, and then we can exchange across the globe. People go and work with the Putu in Indonesia, some go to Stanford. We should think a bit global, a bit that way. Then maybe we can support each other to generate the right information and data. So thank you very much. I think I'll just say we stop there. Mariam, back to you.
Yes, thank you, Dr. Reginald and Dr. Araya, for the detailed feedback, and also Abdullahi. And just like it's been mentioned, I agree we should continue with the exercise. This actually highlights the new areas of focus, like Dr. Reginald mentioned. And for the case of Uganda, well, we've had difficulty around transporting of the computers to the different health facilities because of the distance. And there's been similar experiences like Nigeria, the issues of electricity and internet connectivity. Actually, within the health facility of Lira, the personnel use their personal data to hotspot the computer and basically use that for internet connection. So looking at all these aspects actually does highlight the direction required for the next phase. Well, I think we've basically tackled all the topics, and I don't know if we have any other business for discussion. Maybe Frederick, do you have anything, any updates from your end, or anyone on the call? Okay.
Perhaps just, Madam, just maybe to say that the Zimbabwe team will be joining us soon. They're working on a program that they will share very soon. So that's what I would say about Zimbabwe. Thank you.
Okay. Thank you, Dr. Reginald. All right. That said, I guess everyone have a lovely evening. And thank you for joining the call. Bye, everyone.
Thank you, Mariam. Bye-bye.
Bye.
Bye.
Bye.